Hey, welcome everyone to the third webinar in the We Validate COP webinar series. I'm Arago, Program Manager on the Gender Platform Methods module based at IPRI. Those who have joined our webinar for the first time, our We Validate community of practice is aiming to do one webinar per month. And we had the first webinar in February presented by Lily and Lindsay on AWEA versus AWENI, and the second webinar done by the FAO colleagues on the AWEA phone surveys in Nepal. So please feel free to reach out to me for recordings or any other questions about these webinars. And those who are interested in presenting your work in this webinar series also, please let us know. And now I want to go ahead and introduce our presenters today. We have Meredith Jackson-deGraffenried, who's a global technical advisor for Helen Keller International, currently living in Malawi. She has 20 years of practical and academic experience in civil society, government, private sector, and academia in Latin America, Asia Pacific, Africa, and the United States. We also have Mohammed Abul Kalam, who is a research and monitoring manager with Helen Keller International based in Dhaka, Bangladesh. Over the last 8 years, much of his research has involved informing nutrition and health programs from a sociocultural and ecological lens. And today they will be presenting the study exploring women's self-efficacy in the sociocultural context to improve measurement and understanding of perceived self-efficacy. So before we jump into the presentation, we'll do a few participatory activities with all of you for about 15 minutes on the online platform called Slido. It's SLIDO. I'll talk more about what we're going to do once we're all there. After about 15-20 minutes, and at 8:20 Eastern time, or 20 minutes past the hour, our HKI team will present their study for about 20 minutes, and then we'll open it up to the floor for Q&A. Okay, so then now I'm going to share my screen here. That shows Slido. Just bear with me. Do you all see my screen? Yes, great. So
yes, we do.
I'm going to, okay, so we're going to use Slido, as I mentioned. Please go to your internet browser in any device and type in slido.com and enter this code WEAI, W-E-A-I, or you can use this QR code on the screen to enter. And I think it's probably better to use a phone so you can answer on your phone while looking at the results from the computer screen at the same time. If anyone is having trouble getting in, please feel free to just unmute yourself and let me know, or ask in the chat. I'm sure Hazel could be able to help you if you have trouble. Okay, so I'll just wait a few minutes while people are joining. Just quickly, so we put together two things for this Slido mini exercise. The first is a quick word cloud asking what is self-efficacy for you. And the second exercise is to have all of you answer the new general self-efficacy scale, the one we used in the ProWEA, and we see the results together and share some thoughts on it. I'll talk a bit more about that later. Okay, so let me go ahead and start the word cloud. So yeah, please feel free to just throw in keywords and key elements describing self-efficacy. I'm sure you can submit multiple entries, but there should be a character limit for each entry. So I see some words coming in. So we have self-confidence, we have confidence, achieve own goals. yeah, like you can do it. Have belief in oneself, ability, agency, in control, intrinsic agency, self-confidence, feeling capable. This is good. Yeah, agency is getting more votes. Ability to actualize ideas. Great. So I think in some ways, all of these words and phrases are kind of in line with each other. And I hope this gives some insights and perspectives to our presenters as they go through their presentation and talk about it. Okay, this is great. So we have like 20 people participated. Of course, I'm going to save this results and then get that over to the presenters after this webinar as well. Okay, I think we can move on to the next exercise. Okay. So you probably be able to see the whole the survey poll, including this new general self-efficacy scale. And I want you to just answer this. And I'm going to give you 4 minutes. So like 30 seconds for each statement, just very quickly. So some of you or many of you might be familiar. It's an 8-item measure that assesses self-efficacy. It's been validated globally, also included in the Pro-AI, as I mentioned. And you can just think about how each statement relates to your life and your situation, and then indicate how much you agree or disagree with each statement on a scale of 1 to 5. Okay, so it's 8:08 Eastern time, so I'm going to give you 4 minutes, and then we can go through the results together.
Very interesting set of questions, Ara. and Meredith.
Does that look familiar?
And Kalam. Yeah. Thanks for thinking of that exercise. Maybe familiar to some of us on the call, maybe not so familiar to others. So that should be interesting. I don't know if anybody is having any issues joining Slido, but if there are any issues, feel free to just unmute and tell us, or put it in the chat. I've tried to put the instructions on there
I saw that.
as people have been joining, because they're not able to see the chat. But yeah, how are we doing on the?
So we got, I think, 21 people, and then we have 31 people, right, at the meeting. So great.
Does anybody still need extra time, or I guess that's a good question to ask. Are people still answering questions?
Got another person. Okay, just 1 more minute, I think. All right. Let me show you the results we got. We have 8 statements to go through. Okay, so I'll be able to achieve most of the goals that I have set for myself. Okay, I have strongly agree. Yeah, I can't really spend too much time on this, so you kind of get the idea of how people answer these questions. The next, when facing difficult tasks, I'm certain that I'll accomplish them. We have 61% agreed. In general, I think that I can obtain outcomes that are important to me. We have agree and strongly agree. Many of them chose those. I believe I can succeed at most any endeavor to which I set my mind. Agree. I'll be able to successfully overcome many challenges. Most of the people agreed. I am confident that I can perform effectively on many different tasks. Also, 64% agreed. Compared to other people, I can do most tasks very well. I strongly agree, but I also see neither agree nor disagrees, 26%. And then even when things are tough, I can perform quite well. Agree, strongly agree, neither agree or disagree. Okay, so those are the 8 statements that we had in this scale. So yeah, so it's just the overall results, just combining all of our answers are pretty similar. I mean, most of the people chose either agree or strongly agree, but also we see some people chose neither agree nor disagree. So just to quickly, we wanted to just do this quick exercise before the presentation, because the presenters will touch upon this and talk about the feedback they got from the field. And we didn't want to plant any ideas about the scale while you were doing it. So that's why we started with this exercise before the presentation. And we still have some time, about 7 minutes, to talk a bit about your thoughts or any key takeaways from this exercise or on the statements on the scale, anything, or whether you had any difficulty answering them yourselves. So I'd just like to get a couple people, volunteers, to share your thoughts. It can be very brief. Anyone?
Hazel, if you can thoughts?
Yeah,
can
sure.
I volunteer, Ara? Hi, everyone.
Yes.
This is Emily Myers. I'm a research analyst at IFPRI. So when I was answering the questions, I was just thinking about how, especially for me personally, with all the ups and downs of the last few years, like working through a pandemic, how I'm sure that my answers would change from season to season and whatnot. And I'm sure that would be reflected in perhaps like lean or slack seasons for, study populations working in agriculture. So I guess I'm curious what the temporality of a self-efficacy scale might be.
Thanks, Emily. That's a really good point about like at what point that you actually go through this survey that could really affect the results of it. And we have another hand up from Renata.
Yes, hi everyone. This is Renata Serra. Good to see some of you from the University of Florida. I felt the question about compare to others was a bit off the others. And so I can say I'm one of the person who said neither disagree nor agree, and a lot of people did it. I just felt I was a bit off the fact that I compare to others, while the others were all absolute on yourself. So I don't know how in line, yeah. So I just wanted to communicate this feeling. I really like the one that says in moments of difficulties, I felt that this measured resilience as well, not just self-efficacy. So I like that question.
All right, thanks for sharing. Anyone else? Can get one more person.
Hi, Ara, this is Meredith.
Hi, Meredith, yeah.
I was just thinking it's, there's so much research out there now or evidence showing how poverty and lack of privilege can play into self-efficacy. And I was thinking, you know, we're a bunch of well-educated folks on this call. You know, we're probably fairly confident in our skills, at least you know, in our jobs. And I was thinking, wow, you know, if I didn't have the experience and the education, would I really be this confident in myself? I don't know. I was just taking this. I've actually never taken this myself. I mean, I have, but not really. You know, I've looked at the questions, but never really
answered yourself, right? Yeah.
Yeah.
Same for me. All right. Thanks, everybody. I'm sure that you're gonna mention this again during your presentation, Meredith. Okay, so thank you everybody for participating in this little exercise, and I'm going to stop sharing my screen. And then now I'm turning it over to Meredith to get us started with the presentation. Are you ready, Meredith?
Yep,
yeah.
Let me share my screen. Okay, can you see the,
yes.
I don't have it on the first slide. There we go.
There you go.
Okay, so this is what we're talking about today was part of some research that we did in Bangladesh. And the title of the research project is what you see here, which was exploring self-efficacy in the sociocultural context. And it was to improve measurement and understanding of perceived self-efficacy. So the purpose of, or kind of the quick and dirty of the goal of what our research was to develop a tool we wanted that could measure perceived self-efficacy as it's defined by the people who are answering the questions. And we were taking what's called an EMIC approach in anthropology, which just means an insider approach. And you know, as we've already seen, self-efficacy is usually measured with the general self-efficacy that's included in the ProWea, or other tools that have been developed by others. But all the existing tools are from an EDIC or outsider perspective, developed by academics or researchers, and not defined by the context and the people in the context that we're studying. So we really wanted to understand, you know, if we tried to get a culturally defined scale and definition, would we capture information that would be helpful to our programs that we might otherwise be missing? So just real quick, the research that we did had 4 objectives, and one was the primary one that we're going to talk about today was adapting the rapid ethnographic methods from cultural domain analysis, which come from cognitive and linguistic anthropology, and to adapt those methods to explore the domain of self-efficacy. And we were able to test with 3 different ethnic groups to give us different cultural perspectives. And then we also wanted to use those methods to ultimately develop a perceived self-efficacy scale with EMIC validity. And what I mean by that is that the EMIC validity comes from knowing that the information is valid within that sociocultural context, because the methods that we use are designed to document cultural knowledge. And then we also we had some outcome indicators that we were looking at within the context of the programs we were doing this in, and ultimately wanted to, and are developing a guideline or a tool for practitioners to use in the field to replicate and to adapt. So we've already talked about what self-efficacy is. Everyone has given their opinion, and it's just simply your own self-judgment or perception of your own capability. That's how Bandura, who's kind of the father of self-efficacy, I guess, described it. And it is more recently, we've seen self-efficacy being included in the resilience framework that's used by USAID and others. Chris Benet, Tim Frankenberger, and others are calling this subjective resilience, and arguing that we should be considering self-efficacy and other subjective measures in our model of resilience and our resilience framework. So cultural domain analysis and cultural consensus theory are the basis of the methods that we're talking about today. And cultural domain analysis was developed in '86, coming from cognitive and linguistic anthropology. And it is based on a theory of cultural consensus that assumes that every member of a culture shares knowledge with other members of their culture. And knowledge isn't like book learning or academic, but what they know. It's what do they know? It doesn't matter if they know the right dietary diversity or not. It's what do they think? It's their cultural knowledge. And so it equals their opinions, perceptions, but in cultural domain analysis, we go through iterative data collection steps. And these are to document the content and the structure of a domain. And a domain is anything you want to study. So perceived self-efficacy is the domain that we wanted to study. And we can use a quantitative analysis, which is simply a factor analysis really, to once we get to a certain step in the data collection process, we can assess whether or not there's a statistically sound model of shared cultural knowledge. And that tells us we can take the qualitative and put it into the quantitative. And that's where I think there's a lot of potential application in development that we haven't really started to explore. I mean, some people are, but it's just beginning to be used. And to me, perhaps the most important contribution that this cultural domain analysis makes to development is that it can operationalize culture as an indicator. And it's something that we've been missing, is that how to quantify sociocultural norms from qualitative data, and bridges that gap that we're all struggling with. Is how, we know how to measure knowledge, we know how to measure practice, and we do barrier analyses, but how do we really understand what is, what's the barrier between knowledge to practice? And then what we end up with when we use cultural domain analysis, as you'll see in development, if we think about in an M&E plan or something, we can come up with a measure of the perceptions. So that's going to be your cultural consensus model, or just your cultural model. And at the same time, you can come up with what's called cultural consonants, but it's essentially the physical expression or the mental expression of that knowledge. How do you put that knowledge into practice? Apologize for my dog, somebody's coming in my gate. So the research that we did was in Bandarban in the Chittagong Hill Tracts, and there are many ethnic groups, of 10 to 12 ethnic groups in the Chittagong Hill Tracts, and we were able to work with 3 of them. And we were fortunate enough to be able to work with 2 existing projects that were being implemented, USAID activities that were being implemented in the area. So we had a kind of a ready-made population to work with. And the 3 distinct ethnic communities were Mro, Marma, and Bengali. And we did interviews with frontline staff, our female participants and their husbands, senior men and women, and local key personnel. And this slide really visualizes what we mean by the iterative steps. And what I want to emphasize here is that the process of the data collection is what provides the validation of the data and the results along the way. So each step builds on the previous step. And it starts with cultural informants or key informants, but cultural informants who begin to describe the domain for us from an insider or an EMIT perspective. And as we go through these steps and they build on each other, this is what adds that EMIC validity to the final measurement tool and helps us understand helps us know that we have validated the content of the domain and the content of our cultural model and our resulting scale along the way. And here I'm going to turn it over to Kalam who led the research in country to talk about the different data collection steps.
Well, thank you, Dr. Meredith, for inviting me to present the overall process that we followed during the data collection and analysis. And could you please go to the next slide? Okay, well, we started with conducting key informant interviews to understand the influences of individual perception of capabilities to perform agricultural health behavior. As you know, Meredith already mentioned that our program was more closely to agriculture and nutrition related program that where we conducted the study. So we focused on those particular behaviors. And the second objective was to conducting a key informant interview was to understand how self-efficacy might be defined by each ethnic group that we studied. That means how self-efficacy is defined by 3 different ethnic groups that included Bengali, Marma, and Ro. And the purpose of another purpose of key informant interview was to determine areas of understanding and conceptualization about self-efficacy. I mean, the domain of self-efficacy. That was another purpose to conducting these key informant interviews. And the last purpose of KIIs was to apply learnings from key informant interview to understand results from the free list interviews. As Meredith was mentioned that each step was built upon the previous step, and all the steps were interconnected with based on the findings of each step. And to conduct the informant interviews, we used a purposive sampling strategy to identify the cultural experts or individuals with expertise in the domain of inquiry, and we selected those participants based on their ability to be articulate and regardless of the demographics. That means we considered those respondents who has the ability to explain related domains of the self-efficacy. Next slide, please. The key learnings from the key informant interviews were that the self-efficacy is equal to confidence, that most of the participants of this meeting also mentioned the similar meaning in the earlier participatory discussion. And another important finding is that power is linked with self-efficacy, but they're different, but they're interlinked. And the social support from husband, family, and community are important for a woman to have confidence. That means if women have better support from husband, family, and community, then she's more confident than those who are not getting. And another important aspect of confident women is to characteristic is to behaving well. The women who are following the sociocultural expectation and is necessary to have social support, and which is necessary to be confident. So we have conducted 24 key informant interviews in total, 8 interviews in each ethnic group. And after conducting the analysis of the key informant interviews and based on the findings from that, we conducted free list interviews to understand the cultural, based on the cultural informant interviews that we got from the inductive analysis, and particularly we focused on the study objectives, and also we used some insight from the literature review. Like if you look at the right side of the slide, you can see a sample question that we developed for the free list. The question was like that: please list characteristics of a confident woman. And the sample answer was the woman who has faith in herself, has faith in her husband, and makes her children behave properly, does her work properly, successful in her work, and behave well. These are very sample responses that we got from a sample free list question. And the free list question, the results of the free list question was validated from the results of key informant interviews, and that were the distinct component of self-efficacy. And another objective was to performing free list interview was to determine if free list responses overlap each other, indicating a shared underlying dimension. Next slide, please. Okay, so, and then while performing the analysis, we followed a Smith salience score that is generated from each term. That is, possible score was between 0 to 1, and that was determined by the order of the response that was given by each respondent, and the frequency of response across all respondents. And finally, we used an anthropoid respondent whose responses were more representative of the group. So that means during the analysis using visual anthropoid, we performed this analysis to understand which response was most common, and it was analyzed by each ethnic group and each gender of each respondent. Next slide, please. The step 3 involved with the development of cultural model and perceived self-efficacy skill for the survey module, and we developed a structured questionnaire for understanding structured cultural model. And the questionnaire had 5 options that was agree and disagree type codes, and we also included one code that I don't understand the question. And for the structured perceived self-efficacy questionnaire, we followed the similar pattern to develop the questions and also the codes of that particular question. Could you please go next slide? So these are the statements that we developed for cultural model survey statement, and we based on the analysis from the free list and the validation from the key informant interviews, we developed total 20 statements to understand or to examine the cultural model of particularly around the self-efficacy of women. Could you please go next, please? And for the perceived self-efficacy survey model, we had total 13 statements, and these were also validated from the free list analysis and key informant interview analysis. Next. And step 4 involved with validating the statements that we developed that we showed in the earlier slides, and we got feedback from the community people by conducting 6 focus group discussions with 3 different ethnic groups, and we conducted those focus group with one focus group with female and one focus group with male. And the purpose was of conducting those focus group was to obtain feedback on consensus analysis and PSE questions, and mostly to understand if the questions or the statement we developed are understandable, are the statements meaningful to the participant, and also if the respondent can understand how to provide an answer. So in that step, we developed a checklist that was included to asking question about those particular statements we developed in the earlier step, and those statements was reading aloud to the participants if to understand their language and also the understandability. And based on the feedback and discussion with the focus group participants, we modified the statements a bit, particularly on the meaning of some English language, because the statements were developed in English first and then were translated into Bangla, and then that were also interpreted in their own language. Like Mro has their own language to communicate with among their community members, and Marmo also have their own language. So that's why we had to go through an iterative process to build the statements more understandable among the three ethnic people. And the final step was involved with surveying the community people, particularly the project participants where we conducted this study. And it was the objective was to determine if a shared cultural model of women's self-efficacy does or does not exist across the three ethnic groups, and if different cultural models exist for each ethnic group. And the final objective of this step was to determine if different perceived self-efficacy scales should be measured for each ethnic group. Could you please go next slide? Well, I would like to invite Dr. Meredith again to present the results of our study. So that is all from my end. Thank you so much.
And we're not going to go into all the results. I just wanted to highlight that the consensus analysis did identify that there was one shared cultural model of women's perceived self-efficacy among the three ethnic groups, but our sampling did produce a bias. It was about 3/4 Bengali. So we also ran it separately for each ethnic group and found variation in the models. Overall, it wasn't enough to tease out separate models of what self-efficacy means among the three ethnic groups, but we did produce answer keys for each ethnic group, and that was something that with the variation, we then were able to look at the different variations or different combinations of perceived self-efficacy scale items and determine that going forward in using these scales in these continuing in this project, we will use slightly different perceived self-efficacy scales for each of the three ethnic groups. For example, there's a equal rights to men and women might not be included in all of them. But I just wanted to show that this is the results of going through this process gave us this opportunity to see that there was variation in how self-efficacy is defined, and it does give us a little bit different scale. And I'm going to stop there, and we can talk about other results with some of our key indicators, but I just want to stop there because we've taken up 22 minutes.
All right. Thanks, Meredith and Kalam, for the great presentation. As you mentioned, that if there are any questions related to the results, I think we can always show your additional slides that you put together in the deck. But as I expected, we've got a lot of questions and comments in the chat. So let me go through from the earlier one, which started with Hazel's question. I believe Kalam already answered that. So it was a total of 24 interviews, I think. And then we got another question from Elizabeth. To what extent do aspirations play into self-efficacy? For example, if someone's aspirations are very high, they might not be able to realistically achieve their goals, which can lead to fatalism. Can you tackle that question, Meredith or Kalam? Yeah.
Yeah, so I'm just looking for the question. So to what extent do aspirations play into self-efficacy?
Yeah.
I think, well, we didn't include aspirations in our research, but other evidence shows that it does play in. I mean, it's tied into that whole poverty, locus of control, self-efficacy, all these subjective resilience or subjective measures that can be psychosocial measures, in the sense that the higher your aspirational capacity, I believe the evidence shows the higher your self-efficacy using, and this would be using the general self-efficacy scale. And Agnes or Hazel may be able to say more about this too. And that also ties into locus of control. So having an external locus of control, meaning that it's kind of out of your hands. You may even have high self-efficacy, but not an external locus of control. So still not you may think, well, I have the ability to do it, but this environment I live in isn't going to let me do it anyway. There's not the opportunity, or there's going to be disaster all the time. I'm going to lose everything all the time. So even if I've got the skills, I may not be able to do it. And those are kind of two separate constructs that both play into aspirations. And poverty drives a lot of this external locus of control and low aspirational capacity as well.
Thank you. Please, if anyone would like to jump in, you can just feel free to unmute and let's speak. We can go over to the next question from Alessandra. She said, very interesting approach. How could it be used to combine locally relevant and universal indicators for cross-site comparison, for example, in WEA? Could keeping the domain self-efficacy universal in the tool and then adapting the questions under that domain to local culture work?
So I think that's what a lot of people have tried and are trying with the general self-efficacy scale. And in the sense that it's being contextualized linguistically anyway, adapting the language and trying to make it more understandable and make the comprehension a little better. But I think what we found, so we did a small content validity analysis in Cambodia with the pro-WEA and specifically with the general self-efficacy scale, and found that women felt that the respondents felt that there was a lot of repetition even among those 8 questions, and even adapting it into Khmer, into the local language and other languages, it still was not, there was still not quite a good comprehension, and led to respondent fatigue, where people were just saying, I neither disagree or agree, I don't know how to answer this, or just saying I don't know, or skip the question. But what we didn't show is that we did test in the research we did, we developed the perceived self-efficacy scale from an EMIC perspective, but we included the general self-efficacy scale in the ultimate research that we did, with the different indicators. We looked at resilience, capacity, food security, some nutrition indicators. And what we found is that with resilience capacity, for example, they explain 2 different pieces of resilience. The perceived self-efficacy in a simple regression, not controlling for other factors, but in a simple regression, the perceived self-efficacy scale explained a proportion or predicted a proportion of absorptive resilience capacity, whereas the general self-efficacy scale predicted a portion of adaptive resilience capacity. That effect was lost though when we ran multiple regression analyses, or I think multiple linear regression. Mackenzie can correct me because she was the one that ran all these. But once we started controlling for other factors, the effect held for perceived self-efficacy, but not for general self-efficacy. That was with all 3 combined. When we teased out some of the different ethnic groups, we then saw different effects. It was really interesting. And what we decided, and I didn't show my ultimate conclusion slide, but what we decided was that it was worth the effort to us to go through all these steps, because we ended up understanding more about how self-efficacy is defined contextually. And at the same time, we're able to use that universal construct that's been applied in other contexts, so you can compare it. You know, if you want to have, you know, multi-country comparisons, but at the same time, the process is universal for perceived self-efficacy. So it's a process that is replicable, and the scale is contextualized. So I think they both have very, very much have value in our development work.
Great, thank you. I think the next question is from Ruth. How do you translate self-efficacy into the various languages? Does that influence the responses?
Kalam, you want to take that one?
Yeah.
Yeah, sure. Thank you. Basically, we looked at some key terms that the key informant used to explain self-efficacy. Like when we conducted the interviews for the Bengalis, we used Bengali language. For the Marma, we used their communicable language that they usually use, because they don't know that much about key terms of that Bengali people use. So we have to go through that way to understand the key terms that they usually refer to explain self-efficacy. For example, shakumra, that is locally used a term, self-efficacy. So we during the key informant interview analysis, we go through those terms that referred to those key terms that we wanted to know about the local meaning. So that's how in general, it was inductive process that we used to understand the local terms of self-efficacy.
Thank you. And then we have some interesting comments from Agnes and Renata about, like, you know, having this self-efficacy being influenced by their status in the community or others' approval, and things like that. Agnes or Renata, would you like to just jump in and make any comments and share your thoughts on it, or we can just...
I'll be very brief. I think that part of this has been addressed by Meredith, who said that locus of control and self-efficacy are different concepts. But I find it quite striking that even in our other work in Bangladesh, a woman's empowerment is not only an individual thing, but it's also defined by how she relates to her family and how she feels she contributes to her family. So compared, for example, to other countries, when we were piloting the original version of the WEA, we found this sense of contributing to the family, and family especially, quite important to a woman's definition of her own work. That's all.
Thank you. I see, actually, I see two questions from Rumbi. Would you like to unmute yourself and just ask? If you don't mind.
Yes, sure. Can you hear me?
Yes, thank you.
Great, thank you very much. Yes, I was just interested, I guess, more on both a philosophical and a methodological point. So I've read some work having to do with adaptive preferences, right? Which is when sometimes women, when they are in particular circumstances where they are pervasive negative social circumstances and ingrained gendered social expectations, which can sometimes then change their perceptions, their goals, and their preferences. And I understand that your approach is very bottom up, where you ask the women themselves how they define these perceptions that they have. So my question was, did you take that into consideration, right? When you're understanding what self-efficacy is, how you, if you're able to address this potential indicator measure issue. And then the second question just had to do with focus group discussions, how they were held, if you were able to differentiate the groups between age groups and ethnic groups and any other salient demographic factors to see if the responses were different, if people were among people who were like-minded versus not. Thank you very much.
Rumi, I missed the first part of your question because my internet's in and out. Can you well, to answer your second one, yes, we were able, all the data were collected. The ethnic groups were collected separately and analyzed separately and together as well. The analysis was done together and separately, but then, so by gender and ethnicity. And, but to the first question, I'm reading in the chat too, but are you asking if adaptive, sorry, what did you say?
I'll speak a little bit louder. So my question is being curious about how self-efficacy here is being recorded and defined, right? So according to some other literature, sometimes women's preferences, particularly those who are in low resource environments, their preferences are sometimes not consistent with basic human flourishing. So they might believe, for example, that certain feeding practices which are negative for the baby are actually good things to aspire to, right? So my question is philosophically and also from a measurement point of view, if you were able to address this concept of adaptive preferences where sometimes women's understanding of what self-efficacy is and what their goals are might not necessarily be favorable or positive to their own human flourishing.
That's an interesting question. We didn't, within the scope of what we did, no, we did not address that. Our main purpose in this research was really, it was actually really to use these methods in this context, see how the methods went, if we were able to do, if they were effective and if we thought that it would be worthwhile later to replicate. However, within the context of the programs that we were collecting data in and the participants in those programs, they are both food security, nutrition, and resilience programs. And we were coming in at the end of some programming. So a lot of the respondents had already been participating for a few years in some of these programs, which means they may already have a more positive outlook on what self-efficacy is anyway. We have an opportunity now. One of the programs has been extended. And now we're including the scale in the monitoring plan. So we're going to have this opportunity to see if we shift, if anything shifts in relation to the activities that they're participating in. So some of the women are in marketing groups, some are in maternal child health and nutrition groups. And so what we envisioned that would be one of the uses of this type of self-efficacy tool is to see when you're able to define the cultural model, which is that shared knowledge and agreement, and look at the practices or the expression of the knowledge, are you able to shift both the perceptions and the practices with programming? And are you able to shift those negative adaptive preferences? And that's where we see this really fitting more into like social behavior change activities in some of these programs, because you can identify where might these negative things become, where might you have negative ideas about self-efficacy, like I need to behave well, like I need to obey my husband to have confidence. And maybe culturally we don't change that, but it gives us an idea of where some of these maybe adaptive preferences we don't want, that we're hoping to change as outsiders, where we can start to target our behavior change programming. I don't know if that answers your question. It's kind of.
No, yes, it does. I think so. Thank you very much, Meredith.
Thank you both. So we have, I think, a couple more questions, 2 or 3. So the next question is from Sheila. I'm wondering whether you looked at whether the perceived and general self-efficacy scores were also associated with each other. Kalam or?
Kalam, you want to take this one?
You're muted.
You're on mute.
Yeah. So basically, what we looked at during the regression analysis to predict if perceived self-efficacy is predicting the resilience or adaptive or absorptive capacity better, or the general self-efficacy. But unfortunately, we have not analyzed the association between perceived self-efficacy and the general self-efficacy. But as this is an ongoing process, maybe you can do this analysis, right, Meredith and Mackenzie? Mackenzie is also here. So yeah, we can. It's a good idea to examine those 2 modules together.
Okay. Thank you. The next question is from Hazel. I wonder where this leaves us in terms of how the indicator can be changed or influenced by programming. That's part of the motivation for many users of the ProWea tools. Any insights on this? Would you like to take that, Meredith?
In terms of how we can, how we can use it, I think, going back to the social behavior change, that's really where, to me, I see the utility of these methods in any domain. Agnes knows that we were using these same methods in some consumer studies in Mali and Niger, looking at consumer preferences and purchasing and decision-making practices in markets for nutritious foods. And the purpose of that was to be able to identify where can we target some of our social behavior change interventions and messages. What's meaningful? And I think that's really what this gets to, is what is meaningful to the participants that we can, that gives us information to use to then design our programming to be more effective. If we want to really affect meaningful change, how are we going to do that? We have to know what's relevant, what's going to be salient, what's going to really motivate people within the context. And we might think, for us, it could be, I'm thinking, decision-making power. It might be that we might think decision-making power over large household assets is something important. And maybe that's a large step later in the context where we're working. Maybe it's hypothetical, I don't know, but maybe what a woman says she wants in that situation is really to just be heard. Maybe she just wants to know her opinion was listened to. I think Sheila did some research on this in Bangladesh, really looking at the agency and the voice in the household and what it meant to women to want to change, like what change they wanted. So I think that's where we're looking is if you can come from a contextually defined approach, then in theory, you're going to have more meaningful change, maybe more sustainable change.
Okay, thank you so much. We're right at time. I do know that there's one more question left. Renata, if you can maybe feel free to just reach out to us, or you can just quickly, yeah, that'll be fine. Okay, then we can just address that in the outside of this meeting. And thank you everybody so much for this, especially the presenters. And is there any last comments from Meredith or Kalam, or are you good? Good. Okay. No more. Hazel, nothing.
just thank you, and such an interesting presentation, and
Yes.
I'm glad we did this, and thanks to everybody for joining.
Thanks for your participation, and this was a really great, very interesting topic. And as I mentioned, we have this recording, so feel free to just share with your colleagues, and also to reach out to us if you would like to present in this group, because we obviously get a lot of interesting comments and questions from our peers. So thank you everybody so much, and thank you again for the presenters, and then we'll see you next month. Thank you.
Thank
everybody.
you. Thanks for the opportunity.
Thank you.
Yeah.
Thank you.
Thank
Bye.
you. Bye.
Bye.